Hello friends. Welcome to my channel. So let's study together. Today's topic is human skull anatomy. Let's begin. The human skull is a complex structure that protects the brain and provides support for the face and sensory organs. It consists of several bones that are fused together. Here are the key features and anatomical details of the human skull. Cranium. The cranium is the upper part of the skull that encloses and protects the brain. It consists of 8 bones. Frontal bone forms the forehead and upper part of the eye sockets, orbits. Parietal bones, 2 bones located on the sides and top of the cranium. Occipital bone forms the back and base of the skull. Temporal bones, 2 bones on the sides of the skull, near the ears. Ethmoid bone, located between the eye sockets. It contributes to the nasal cavity and eye socket walls. Sphenoid bone, located in the middle of the skull. It helps form the base of the cranium and eye sockets. Facial bones. The facial bones provide structure and support for the face. They include maxilla, the upper jawbone that forms the central part of the face, including the upper dental arch. Mandible, the lower jawbone, which is the largest and strongest bone of the face. Zygomatic bones, known as the cheekbones, they form the prominence of the cheeks. Nasal bones, small bones that form the bridge of the nose. Lacrimal bones, thin bones located within the eye socket, near the inner corner of the eyes. Palatine bones form the posterior portion of the hard palate, roof of the mouth. Vomer, a thin, flat bone that forms part of the nasal septum. Inferior nasal conchae, thin, scroll-like bones located on the sides of the nasal cavity. Sutures. Sutures are fibrous joints between the cranial bones that allow for slight movement during birth and growth. The main sutures include the coronal, sagittal, lambdoid, and squamous sutures. Foramina. The skull contains several openings known as foramina, through which nerves, blood vessels, and other structures pass. For example, foramen magnum, located in the base of the skull, it allows the spinal cord to connect with the brain. Optic foramina. These openings in the orbits allow the optic nerves to pass from the eyes to the brain. Sinuses. The skull also houses air-filled cavities known as sinuses, which help reduce the weight of the skull and provide resonance to the voice. The major sinuses include the frontal, ethmoid, sphenoid, and maxillary sinuses. Fontanelles. In infants, the skull contains soft spots called fontanelles, where the cranial bones have not yet fused. These fontanelles allow for flexibility during childbirth and rapid brain growth. Thank you so much for watching.